Considering a hair transplant? Had one before? Are you a hair transplant professional? HairTransplantSociety.com is for you. We're connecting patients with each other to share experiences, connecting patients with clinics and doctors, and connecting clinics with employees. Join today.
Hi there. Here we are with our patient Rod. Rod is here after a 9-year hiatus after his first hair transplant. We did his first surgery when he was about 26 years old. We did a MaxHarvest hair transplant procedure, and 9 years later he's back for more. How did the first procedure go for you?
Oh, thank you, doctor. The first procedure went amazing. I was very pleased. I was really receding, hairline really hollow at several areas, so as you can see, I'm very pleased with the results. So 9 years later, I decided to go ahead and do another touch-up, you know, to get more density, and of course I came back to Dr. Bolton.
Awesome, man. Do you remember having any pain or any issues with your first procedure at all,
well,
9 years ago?
Not at all. Maybe a little discomfort in the first day, but it's to be expected. But everything that I felt, the doctor had told me I was going to feel, but I took some sort of pain medication and it all went away within the first day. Then after that, it was just a healing time.
Excellent. Okay, so you were 26 when we did the first one.
Yes.
You're now 35.
Yes.
What brings you back in 9 years later?
I want to look 26 again.
Okay. So, but did you feel throughout that time period that you needed to come in sooner? Because I have a lot of patients that'll do what you're doing.
Yeah.
They'll do a procedure, then I see them about 10 years later, they decide it's time for another one. What brought you in specifically?
Well, I figured that at this point, the hair that I have is pretty much the transplanted hair that you did, sir. And so I just wanted to go ahead and get a little bit extra density on the top.
Just fill it in.
Fill it in and such, yeah. Okay. So that's where we're trying to achieve today, and I'm very confident that the results will be amazing.
Excellent. Now, do you use Propecia or Rogaine?
I used Propecia for about 20 years.
20? Wow, okay, great.
Yeah.
And do you have any issues, side effects, or anything like that?
No side effects.
Okay.
Very mild drug, and it works perfectly.
Okay, excellent, excellent. And so what would you say to somebody who's thinking about having a hair transplant?
This is the man. Dr. Bolton is amazing. I'm very comfortable. I've sent several of my friends and colleagues here, and they're all feel the same way. You know, you can read his testimonials and watch his videos, and you're going to see that this guy is the best surgeon in the country.
Thank you, brother. I appreciate that.
No problem.
So when we do that MaxHarvest hair transplant procedure, what we're doing is we're recreating the natural hairline, or restoring the natural hairline, filling it in and framing it, and then going through and just kind of thickening everything up. So I'm just going to kind of turn the patient here for a second. As you can see, it just completely reframed him. Looks nice and natural from all the different angles. So no matter which side you look at him at, you know, if his hair is kind of blowing this, you know, look at that. Just soft and natural with the little tiny 1 hair grafts around the front, little 2-3 hair grafts behind it. That's the suture line right there. So you can kind of see it underneath there. And I have a lot of patients that are very concerned about how this line looks. And I tell them if you follow the instructions, it should be an undetectable trace line just the way Rod's is.
I've gone to several hairstylists, and not even they are the professionals. They noticed that I've had a hair transplant. The results are amazing and very natural.
So the hairstylists have not noticed, correct?
Not even my hairdressers,
okay.
Hairstylists.
Excellent.
Nobody.
And when you cut your hair short, can you see your suture line in the past 10 years? Has anyone ever seen it? Or
no, I have not.
So we have a lot of patients that are seeking something called an FUE, a follicular unit extraction, so that way they don't have to contend with the suture line. And what that procedure does is it causes more scarring, and believe it or not, it's more visible when the patient shaves their head versus a linear line if it's done properly. So I just still to this day don't understand why anybody's getting that procedure done when you could have a undetectable suture line and get more hair. Anyways, I want to thank you for doing this video.
Thank you, doctor.
Congratulations. We're going to get you a lot more hair today, and maybe we'll never have to do any more after this.
Fantastic.
But if not, we'll see you in another 10 years.
I look forward to it. Thank you.
Congratulations.
Thank you.